Today I'm going to do an opioid presentation. This is Melina and Alyssa. They are registered nurses that are working alongside of me. Hi, this is Amanda Moore. I'm a registered nurse that is going through the RN to BSN program at the Mississippi University for Women. Today I'm going to be talking about the opioid crisis. I've introduced you to my audience and now I'm going to get started. Today we're going to talk about the several different objectives we're going to go through. The statistics on national opioid crisis, its impact on healthcare, signs and symptoms of opioid abuse, and how our community is combating these issues. There are multiple types of opioids, and when we say opioids, this is going to be what we're discussing. We're talking about prescription pain medicines, heroin, and fentanyl. The data that we're going to discuss today is based off of 2018 statistics. That's the most recent data. According to the 2018 statistics, approximately 128 people die every year from opioid abuse and misuse. This creates a very big financial burden on our healthcare system. Approximately $78.5 billion a year is spent on opioid abuse and misuse. It's very common to see opioid abuse, and the deaths from opioid misuse in 2018 were greater than 46,000. And then another 1.7 million suffered from opioid abuse disorders. The significant burdens on healthcare is due to the financial and resource strains that we see, people coming into the hospitals, people having to be taken care of outpatient, people who struggle at home. There's lots of symptoms you can look for in your patients that may be suffering opioid abuse. The number one symptom is going to be doctor shopping. They're going from one doctor to get prescriptions to another doctor to get more prescriptions, things like that. In their individual symptoms can include constipation, nausea, drowsiness, decreased respiratory rate, poor coordination, poor decision making, requiring more pain medicine to control their pain. These are just some of the symptoms you can look for when you're trying to figure out if somebody might have an opioid problem. Our communities are combating the opioid epidemic in many ways. One of the local things that we deal with is the Overdose Data and Action Center. And what they do is they monitor opioid use, they monitor prescription use, and they also prevent opioid abuse. Another one is HEAL, helping to end addiction long term, and they fund projects and research that helps tackle the opioid abuse in America. Another one is the Opioid Action Team, and they help reduce the amount of prescription meds and also increase the availability of Narcan. Lastly, one we're going to discuss is Pine Grove Behavioral Healthcare and Addiction Services, and this is a center that provides addiction services to people in the area with opioid addiction. Thank you very much.